Types of research in rehabilitation. Welcome to this tutorial on types of research in rehabilitation. Today, we'll explore the main categories of research and their subtypes. This is very important to know the difference for conducting meaningful research. 1. Quantitative and qualitative research. Quantitative research involves measuring outcomes using numbers to produce clear, objective results. For example, if we conduct a study measuring pain scores in back pain patients before and after a treatment, that's quantitative research. Qualitative research is more narrative, focusing on patient experiences. Interviewing patients with chronic neck pain about how it impacts their quality of life is qualitative research, helping us understand their perspectives beyond numbers. 2. Basic and applied research. Basic research explores fundamental concepts without immediate clinical use. For example, studying spinal disc stress at a cellular level may not directly affect current treatments, but builds foundational knowledge. Applied research aims to solve practical problems. For example, testing whether a new back pain exercise program improves function in patients is applied research, providing actionable insights for clinicians. 3. Translational research. Translational research applies basic science findings to clinical questions and vice versa, also known as bench-to-bedside research. An example might be if lab findings show a certain protein speeds muscle repair. Translational research would examine using this in a clinical setting to treat neck or back muscle injuries. 4. Experimental research. Experimental research explores cause and effect through controlled trials. Here are its key types. Randomized controlled trials, RCTs, considered the gold standard. RCTs randomly assign patients to different groups to compare treatments. For instance, we could compare the effect of a new exercise versus traditional stretching for back pain. Quasi-experimental studies. This study either has only one group or lack random assignment. For instance, if we study a specific exercise for neck pain relief in one clinic without a comparison group, it's quasi-experimental. Single-subject designs focus on individual case studies to assess treatment effects, often for innovative or rare interventions in rehab settings. 5. Descriptive research. Descriptive research documents characteristics of a population. Key types include developmental studies, track changes over time, such as monitoring back pain progression in aging patients to understand natural trends. Normative studies. Establish standards or norms for certain populations, like determining average neck flexibility across age groups to guide rehab goals. Descriptive surveys. A descriptive survey gathers data to provide an overview of characteristics, behaviors, or conditions within a specific group or population. It often uses questionnaires or interviews to collect information that can help understand trends and patterns. Case studies or case series. Focus on one or a few patients, documenting unique symptoms or responses to new treatments in detail. This approach often inspires larger studies. 6. Exploratory research. Exploratory research examines relationships or associations between factors without direct intervention. Main types include correlational studies. Investigate relationships, such as examining if patients with poor posture are more likely to experience back pain. Correlation doesn't imply causation but can suggest patterns. Cohort and case control studies. Common in epidemiology, these studies compare groups over time or by exposure to certain risk factors, like assessing if desk workers are at a higher risk for neck pain. Predictive models. Predictive models use data to anticipate outcomes and guide decision-making, such as setting expectations and prognosis. By establishing associations, they allow researchers to test or model theoretical propositions, helping refine clinical decisions and planning. Methodological research. establishes reliability and validity of assessment tools like testing the accuracy of a back pain assessment scale in rehab settings. 7. Synthesis of literature. Synthesis of literature involves combining findings across studies to summarize evidence. Key methods include systematic reviews, comprehensive reviews of all available research on a specific question, such as examining various treatments for chronic back pain. Meta-analysis statistically combines results from multiple studies to produce an overall effect size. For example, pooling data on neck pain interventions can provide a clearer view of the most effective treatment. Scoping reviews provide an overview of research trends, highlighting gaps and areas for further exploration, such as mapping the existing research on spinal rehabilitation. Conclusion: we have discussed the different types of research designs. It is important to understand the basic differences of all types of research. Thank you for joining this overview on research types in rehabilitation.